Hello, my name is Lene Robbins, and I am going to be presenting the communicable disease malaria. The epidemiology triad for malaria, the agent is Plasmodium falciparum or two other Plasmodium parasites, and then the host is human beings. The environment depends on the local prevalence of mosquitoes. It also depends on where the area is, if it's swampy, the climate, and the vector is the female Anopheles mosquito. So, some history and facts about malaria. In the 1950s, malaria was eradicated from the U.S., and almost every case since then has been found in people that have traveled recently. The Center for Disease Control and Prevention was originally formed to fight malaria, and it was known as the Communicable Disease Center. The CDC is headquartered in Atlanta, Georgia, because the South faced the worst threat from malaria. 8 presidents have experienced malaria, including George Washington and John F. Kennedy. George Washington didn't die from the disease, he just suffered from recurring bouts throughout his life. And John F. Kennedy actually got it in the Solomon Islands during World War II. Hippocrates was the first physician to describe the manifestations of malaria, and he was able to relate them to the time of the year and where people lived. Also, the Nobel Prize in Physiology or Medicine has been awarded 5 times for the malaria-associated work. Factors that impact the life cycle of malaria. Malaria parasites have to be present, as well as female Anopheles mosquitoes and a human host. Climate is a very important factor because if it is below 59 degrees Fahrenheit for the Plasmodium vivax, the parasite cannot live, and also for Plasmodium falciparum, that would be 68 degrees Fahrenheit. Breeding takes 9 to 12 days, and the breeding grounds can dry up or be drained away during that time. Also, the adult mosquitoes have to live long enough to come in contact with the human host and transmit the disease. The incubation period for malaria lasts between 7 to 30 days after the bite that infects the host, depending on what parasite was introduced. Anti-malarial drugs can delay the symptoms for weeks or months, which can cause a misdiagnosis. Some routes of transmission. The route of transmission by mosquitoes is most common, but also there can be congenital transmission, which is when a pregnant woman transmits it to her child before or during delivery, and that can happen, but that's very rare. Transfusions of blood can also transmit malaria because the parasite is in the blood of the host, and so if a person wants to donate blood, they're thoroughly questioned and they can be deferred if they've traveled recently. Some commonly impacted populations are those that live in tropical and subtropical climates, and also people who live in Papua New Guinea or in Africa south of the Sahara Desert, and also in India. Those populations can be affected. The geographical distribution, so the red parts, which is mostly in the south, the southern continents, especially Africa, and you see some in South America. Those red parts are where malaria transmission is very widespread. And then the yellow parts, malaria transmission only occurs in some of those parts. And then the green, that's where malaria transmission is not known to occur, and most of the U.S. is included in that. So the first signs in humans, in uncomplicated malaria, which is classic but rarely observed, patients present symptoms such as fever, chills, nausea and vomiting, and general malaise. But severe malaria, patients present symptoms such as anemia, low blood pressure, acute kidney failure, metabolic acidosis, and hypoglycemia. So in some cases, the malaria can be infrequent in these countries, so the symptoms can be attributed to influenza, colds, common infections, especially if malaria is not suspected. Also, in countries where malaria is frequent, residents can recognize the symptoms and they treat themselves without a diagnosis. This disease is reportable to the Mississippi State Department of Health. It is a Class 2 condition, which doesn't require immediate public health response. this is compared to a Class 1A condition, which has to be reported within 24 hours of the first knowledge or suspicion, and it requires an immediate public health response. The MSDH site states that this condition needs to be reported by mail, telephone, fax, or electronically within 1 week of the case being diagnosed. Medications that are used for treatment of malaria include Malarone, chloroquine, quinine, and doxycycline and clindamycin can actually be used in combination with that drug. And then for the parasites that go dormant within the liver and come back, dormaquine is used. And treatment also depends on factors such as the type of infecting parasite, pregnancy, drug allergies, and the area in which the patient contracted the parasite. Some precautions that people can take. Southern states have the most risk for malaria, but there are precautions that can be taken, such as draining all possible breeding sites, such as puddles, buckets, unused pools, and other stagnant water sources. They can spray pesticides, and many places, that's a service that can be provided by the local government. I know I lived in New Orleans for most of my life, and it was common to see the truck coming by spraying the pesticides for mosquitoes. My mom would always make us go inside. It was right at dusk, and we would have to come inside from playing because she didn't want us to breathe it. And also, people can cover up. The more that you're covered by clothing, the less skin is available for mosquitoes to bite. The levels of prevention. So the primary level can include education about the areas where malaria is endemic, so that travelers can be aware of the risks and either not travel to those countries or take precautions when they do. Also, education on how to prevent getting bitten by mosquitoes is very important, and that's the 4 Ds: dawn, dusk, deet, and drain. Secondary level of prevention includes screening for symptoms and anti-malarial drugs for people that have traveled and may have contracted the condition. Tertiary prevention is treatment of the condition and any relapses. Some public service campaigns. In 1943, Disney made a short film featuring the 7 dwarfs from Snow White, and it's called The Winged Scourge, and it deals with the public health issue of malaria. I looked at this video. It's 10 minutes long. It was cute, and it was very informative, and it gives multiple ways to mosquito-proof your home and get rid of breeding grounds. This was created back when malaria was not eradicated in the U.S., so it includes some things that we don't necessarily need to do today, like covering your bed with a net, but if we were in a different country where it was endemic, we would need to do that. And also, here's the ABCDs against malaria, and it's awareness, bite prevention, chemoprophylactic, and diagnosis. My public health alert is cover up. Don't let mosquitoes give you malaria. See www.cdc.gov. And these are my references.